This is one of my least favorite responses that I get from patients when I ask them a question like, how's the pressure, right? How's the pressure it sounds like an open-ended question, but it ends up being closed-ended in terms of open-ended question is you ask a question and you can have this multiple range of responses. Closed-ended questions are often viewed as yes or no. And while how's the pressure sort of invites this, well, it's good, it's bad, or whatever, it ends up being I'm fine with it, or I can take it. Which, what does that really tell me? Um, is it telling me that more pressure is better? That I need to get in there deeply and really beat the snot out of things? Or are there different ways to communicate this whole pressure concept? The work that I learn and the work that I teach is one that should be nuanced. It doesn't have to be more is better. But yet sometimes the psychology of the process, and whether it's our patient's process or whether it's the process that we're working with our patients with, becomes that thought that, well, if a little is good, more must be better. Well, I tend to disagree. I think that I need to negotiate pressures with my patients all the time, and not to get them to believe that, boy, it's been there so long that I need to beat the crap out of you to do something. And whether it's, it's a quad problem or a neck problem or a voice problem or swallowing problem or a headache, right? Is more better? Maybe for some patients it is. But I don't want to be the one to try and convince you that more is better. I want to try and have a partnership with my patient and negotiate at all times. So when I ask a question like, how's the pressure? I want a nuanced answer. I tend to avoid how's the pressure. I'll ask questions like, does this pressure feel useful? Does it feel helpful? Is there anything about the pressure right now that feels like it could be harmful? And if so, I need to back off. I believe in negotiation with my patients, that whatever we do should be a partnership, one that they really initiate, that not I try and convince them of something, but it becomes them saying to me, yes, I like what you're doing right now. This feels like it could be really helpful, and there's nothing about it that feels like it could be harmful to me. Because if not, I need to adjust things. I need to negotiate things, and I need to not try and get you to simply lay there or sit there and take it. I think that's dangerous. I think it sets bad boundaries. I think it sets you and I, the therapist, up for potential problems in terms of injury, and whether it's real physical injury or psychological harm of them laying there feeling like they need to take what you give with no input of their own. So next time you hear this from a patient, why don't you rephrase the question? Ask it a different way. Say, I'm proud of you, or that's fine that you can take it, but do you need to? Is it necessary? Or are there other ways we can do this work that you might find even more helpful?